Hi, let's talk about the larynx, specifically laryngeal cartilages, membranes, and cavities within. In this video, we'll talk about the larynx, the cartilages which comprise the laryngoskeleton, membranes, and the cavities within the larynx. We'll also discuss the relevant anatomy for airway management. So what is the larynx? The larynx colloquially is referred to as our voice box. It's really the most proximal portion of what would exclusively be the respiratory pathway. So the larynx, which I'll encircle here, sits inferiorly from the hyoid bone. It's suspended from the hyoid bone by the thyrohyoid membrane. It sits atop the trachea, and it suspends the trachea by the cricotracheal ligament. And it's sitting anterior to the pharynx, specifically the laryngopharynx. And it's that laryngopharynx, and I'll circle that region here, which is the portion of the pharynx which there's a decision whether materials will be moving through the respiratory pathway or along the gut tube. So this is a crucial bit of anatomy here for the respiratory system as well as the GI system. If we're comparing this to vertebral level, the larynx generally sits around C4 to C6-ish. Sometimes in individuals this may be a little higher, up to C3 and sometimes even beyond, or even lower, C7, T1, sometimes even beyond. There is a wide range of where the larynx sits, but generally we say C4 to C6 when we relate this to vertebral level. Before we move on, I think that it is a good time for us to talk about a structure within the oropharynx, which is sitting just superior to the larynx. So on the left-hand side here, we see the tongue, and this would be the portion of the tongue that resides in the oral cavity. Here would be the portion of the tongue that sits within the oropharynx. And arising from the root of the tongue here, we can see the epiglottis, or the superior portion of the epiglottis, and I'll outline that right here. So that epiglottis is the epiglottic cartilage of the larynx, which is invested with mucosa. And if we look along that superior edge here, there's a little bit of a trough. This trough is the epiglottic valleculae. There are two vallecula on either side. So that is a epiglottic vallecula, and that is an epiglottic vallecula. Together they are the valleculae. And these are really indentations comprised of or formed by three folds. So laterally here we have the lateral glosso tongue, epiglottis folds. And then medially here, and these names rather do make sense, is the median glossoepiglottic fold. So these are running between the epiglottis and the fold. And these are really important functionally for us because, as we salivate, that saliva, that spit, begins to move distally through the pharynx, and it collects in these valleculae, so they serve as saliva traps for us, or spit traps. And the reason why this is important is that if they didn't have a place to go, they would trigger the deglutition, or the swallowing reflex. So these valleculae buy us time to not be constantly swallowing. These are also a very important landmark for laryngoscopy, so for being able to visualize the larynx with a laryngoscope, specifically a Macintosh style bladed laryngoscope. Those blades go within the valleculae so that the tongue can be withdrawn and one can get a better view of the inside of the larynx. So let's take a look at the laryngoskeleton. And we have both right lateral views as well as posterior views. We'll see many other views throughout this particular video, but I think that for establishing the laryngoskeleton, these will do very well. So the laryngoskeleton is a series of cartilages. Some of them are paired, some of them are singular, but together they're going to form the larynx. Some of the major cartilages that we'll see in understanding the function include the thyroid cartilage. I'll outline that for you right here. The thyroid cartilage consists of really two laminae coming together along a midline. So posteriorly, you'll see that that thyroid cartilage is incomplete. There's no back to it. It's all front and sides. That thyroid cartilage sits atop the cricoid cartilage. Cricoid cartilage is a complete ring, so all the way about the larynx here, and it is the only cartilage which is 360 degrees complete about the larynx. Cricoid comes from the Greek krikios, which means ring. There's also the epiglottic cartilage, which we've seen already. That epiglottic cartilage comes down, forms kind of a stem and leaf structure there. So the thyroid, cricoid, and epiglottic cartilages are all singular cartilages. There is but one of them. The remainder of the cartilages that we'll talk about are all paired. And these are best viewed posteriorly. Let me erase some of these lines here. So I should have left the cricoid line. So that's the cricoid cartilage there. The next pair of cartilages are of supreme importance for the function of the larynx, and these are the arytenoid cartilages. Arytenoid cartilages are pyramidal shaped, and they sit atop the cricoid cartilage, the lamina there. And these are the most kinetic or mobile cartilages. These move about. They have muscular processes laterally. Those muscular processes allow the intrinsic muscles of the larynx to attach to the arytenoid cartilages to affect movement. And anteriorly, we probably can't really demonstrate this in this view, but anteriorly there are vocal processes which connect vocal ligaments to the thyroid cartilage. There are also vestibular ligaments which connect these arytenoid cartilages to the thyroid cartilage, and we'll see these later. Sitting atop the arytenoid cartilages are the corniculate cartilages. And it's between the arytenoid cartilages here and the corniculate cartilage that we have these folds called the airy epiglottic folds. And within these airy epiglottic folds, and we'll discuss these later, are another pair of rod-like cartilages called the cuneiform cartilages. And they help maintain the patency of the laryngeal inlet. There are many other types of cartilages that can form within the various membranes and ligaments of the laryngoskeleton, but these are the major ones. These are all comprised of hyaline cartilage, and as people age, they become increasingly more calcified. And this process of calcification begins at about 18 years of age. So let's take a look at some of the features of these laryngeal cartilages. Let's start with the thyroid cartilage. Recall the thyroid cartilage is suspended from the hyoid bone here by this thyrohyoid membrane. And the thyroid cartilage has superior horns. Those superior horns are going to be able to connect via thickenings of that thyrohyoid membrane to the greater horns or cornua of the hyoid bone. There are also inferior horns. These inferior horns are able to articulate with the cricoid cartilage to form the cricothyroid joint, and that's the joint upon which the cricothyroid muscle, so we can see here, acts. Each side of the thyroid cartilage is a lamina. So we have two laminae. Those are shields. And then where these laminae meet along the midline, there's a thickening of that cartilage called the laryngeal prominence. That laryngeal prominence tends to be a little more robust in men, and this is colloquially referred to as the Adam's apple for that reason. Despite sex being something that is continuous, we often in anatomy will discuss it as if it were more discrete than that. So the cricoid cartilage sits below the thyroid cartilage here, and it is the only cartilage, as I've said, which is complete. 360 degrees around. And then that epiglottic cartilage, the stem of it articulates with the thyroid cartilage anteriorly. The leaf is superior here, and it sits like so. The arytenoid cartilages are really the heroes of the larynx with respect to doing things, whether it's phonation or breathing. So as they sit upon the cricoid cartilage, they can glide either medially or laterally, or they may be able to pivot inwards or outwards. So we can see a superior view of what's going on here, and so I'll just outline for you. That's the thyroid cartilage. There's the cricoid cartilage. And then here is the arytenoid cartilage from above. Now, keeping in mind that the arytenoid cartilages are more like funnel-shaped or pyramidal, with the apices of those pyramids there and there. And so here we get a really good sense for those processes. So there's the vocal process, and there is the muscular process of the arytenoid cartilage. And in this case, that vocal process is an attachment site for the vocal ligament that runs to the anterior portion of the thyroid cartilage. So that vocal ligament is going to be associated with muscle and mucosa, and so that's what one would refer to as the vocal cord in total. There's also a false vocal cord formed by a vestibular ligament, which also attaches higher up on the arytenoid cartilage and goes to the thyroid cartilage, which we'll see better in profile. And then finally, we have the muscular process here. Some, not all, but many of the intrinsic laryngeal muscles are going to attach to that muscular process. And so here we can see here, let's erase this so that we can truly see this. Here we can see the vocal ligaments are adducted, so they have been swung towards the midline. They are not completely adducted. Otherwise, this space, which is the rhimaglottitis, would completely go away. But these are moved more towards the phonation position. Whereas here we can see that those vocal processes have been pivoted outwards, and with them go the vocal ligaments, and so these are abducted or abducted. And then, of course, we have our corniculate cartilages atop the arytenoids and the cuneiform cartilages sitting in those airy epiglottic folds. We have a laryngoskeleton, and there are also intrinsic laryngeal membranes associated with that laryngeal skeleton, and these membranes are going to help direct the flow of air. Recall, this is a very important region for air exchange, and so moving air in and out of the larynx to affect different functions is going to be important. Now, there are going to be two sets of membranes. Superiorly, we have the quadrangular membranes, and inferiorly, we have something called the Conus elasticus, and we'll talk about those in detail now. So let's start with the superior membranes. There are two, one on either side, called the quadrangular, four-sided membranes, and there are a couple of aspects of these membranes that are important to us. But first, let me just outline those quadrangular membranes here. So it would look kind of like that. Please excuse my drawing ability here. And these extend even, I guess I did a poor job, but they extend even onto the epiglottic cartilage there. There are a couple of features of these quadrangular membranes that you're going to want to know about. One that we can see here and have previously discussed, the airy epiglottic ligament. So that airy epiglottic ligament runs between the epiglottis as well as the arytenoid cartilage and even a little bit of the corniculate cartilage. And it's within here that the cuneiform cartilages reside. These airy epiglottic ligaments are forming the margins, as well as the interarytenoid notch there, of the laryngeal inlet. So these quadrangular membranes really help to shape the opening between the larynx, in particular the laryngeal vestibule, and the pharynx, or the laryngopharynx, if we're being specific. So on the photograph here, we can see these are the airy epiglottic ligaments dissected out there, and here they're still encased in the mucosa. We can also see from this posterior view of the opened larynx, so the cricoid cartilage has been incised and has been reflected laterally to open this up. We can see the inferior-most aspect of the quadrangular membranes called the vestibular ligaments. Recall, vestibular ligaments run between the arytenoid cartilages and the thyroid cartilage. These are sometimes called the false vocal folds. And sometimes you'll even hear them referred to as ventricular ligaments. So vestibular ligaments are the same thing as ventricular ligaments, which are the same thing as false vocal folds. Whew, that's quite a bit. So if we were to sort of outline, there is a complete quadrangular membrane spanning the distance between arytenoid cartilage, epiglottis, and thyroid cartilage. And so helping air in or out, but more importantly, in through the laryngeal vestibule. We can see a little bit of the next membrane. This is a singular membrane called the Conus elasticus. So there would be a portion of the Conus elasticus, probably the lateral cricothyroid membrane, as we'll see. The superior-most portion of the Conus elasticus is that vocal ligament running from the vocal process of the arytenoid cartilage to the thyroid cartilage. So we can see it there. We can also see it there. The remainder of the Conus elasticus is actually going to spread the distance between the cricoid cartilage and laterally that vocal ligament and the arytenoid cartilage. So there, and then there's even a little bit of it anteriorly here between the cricoid cartilage and the thyroid cartilage. So if we look at it superiorly here, there's the lateral cricothyroid ligament, and then there's the median cricothyroid ligament, or at least half of it. The conus elasticus is going to be an important membrane for directing air to the rima glottis. That is the space between the vocal folds here. So whether that's for breathing or for phonation, but most importantly for phonation, the producing of sound as air vibrates the vocal folds. That's what the conus elasticus is going to do. The conus elasticus goes by several other names. Sometimes you'll hear it referred to as the cricovocal membrane, or even just the cricothyroid membrane, but more often than not, as anatomists, we refer to this as the conus elasticus. So let's talk about the cavities within the larynx. So here, this is a cadaveric photo. The cricoid cartilage has been incised, and we've rotated it out and laterally. So we can see that there's a lot of empty space here, and that empty space is going to be flanked by membranes. So superiorly, our quadrangular membrane, here is our airy epiglottic fold. Here's the remainder of that quadrangular membrane, all the way down to the vestibular ligament there. So airy epiglottic fold is the superiormost portion of the quadrangular membrane. The inferiormost portion is the vestibular ligament. With respect to the conus elasticus, the superiormost portion is that vocal ligament. And then we have the cricothyroid membrane below that. Now between the vestibular ligament and the vocal ligament, we have space. That space is called the laryngeal ventricle. The laryngeal ventricle. Now let's give names to other spaces as we move through. So there's our laryngeal ventricle, and it is a little more extensive laterally than we can see at this point. I'll just color this in here to emphasize that. Immediately superior to the laryngeal ventricle, we have that the vestibular folds, right? And the space between those vestibular folds is known as the rima vestibuli. That rima vestibuli is contiguous with the laryngeal vestibule. So laryngeal vestibule into the rima vestibuli, into the laryngeal ventricle. And then through the rima glottis, that's the space between the vocal folds, is the rima glottis. And then below that is the infraglottic cavity. And that infraglottic cavity is going to be contiguous with the trachea. So as air moves in or out, air is going to move through the laryngeal vestibule, through the rima vestibuli, through the laryngeal ventricle, through the rima glottis, through the infraglottic cavity, and then down through the lumen of the trachea. With respect to airway access, there's some very relevant anatomy to discuss. Now, there are two forms of airway access that we'll discuss here. The first being the Cricothyrotomy. The cricothyrotomy is when the skin, the subcutaneous tissue, and the median cricothyroid ligament are incised. In order to find this, one would palpate for the laryngeal prominence, and then they would move their finger inferior to that, and you can feel a little bit of a divot before again feeling the cricoid cartilage. That divot there is that median cricothyroid ligament, so that's part of the Conus elasticus, and that may be incised and cannulated so as to maintain a patent airway under emergent situations. The nice thing about this is that there are very distinctive anatomical landmarks that can be palpated, and there really aren't any elements of vasculature that are significant enough to pose a risk here. So this may be done in the field under emergent conditions. The other form of airway management or airway access intervention that we could discuss is a tracheotomy, also known as a tracheostomy. This is a surgical intervention, so this is not done in the field. And what is done here is that there is an incision of the skin, usually about 1 centimeter above the jugular notch. So if we go a centimeter above that, they perform a vertical incision here of the skin, and they would visualize any of the vasculature in the way. So in this case, the inferior thyroid veins pose a problem, and in about 10% of cases, the thyroid ima artery are going to also be in the way, and so these need to be moved out of the way, and the trachea can be incised and cannulated, and this can be a site for long-term airway. And that leads us to our assessment question here, that being the vocal and vestibular ligaments connect the arytenoid cartilages to which other laryngeal cartilage? Would it be the corniculates? No, those are formed in the epiglottic folds. The cricoid? No, the arytenoid cartilages sit atop the cricoid cartilage. Cuneiforms? No, those are in those epiglottic folds. I'm sorry, corniculates are atop the arytenoid cartilages there. Epiglottic? No. Thyroid? Yes. So if we think about this, and let's kind of view this laterally here. So here's our good old thyroid cartilage. There's an inferior, it's a superior, it's terrible. And then that's sitting atop our cricoid cartilage. And then our arytenoid cartilages sit atop the cricoid cartilage there. We would have a vocal process going to the vocal folds, and then vestibular folds also going there. So those vocal and vestibular folds are running between the arytenoid cartilage and the thyroid cartilage. So the correct answer is E. Thank you very much for your time.